One of the things we spoke about on the phone, which I'm going to ask you about now, is the rural health programs. You noted in your remarks today and previously that New Jersey was awarded $147.3 million from the Centers for Medicare and Medicaid Services Rural Health Transformation Program, which will impact 1 million, approximately, rural New Jerseyans, including 250,000 family care members in 11 counties. And that is from H.R. 1, correct?
That's correct.
The Department of Human Services is administering 40 million of that rural health transformation grant. Can you break down precisely how those dollars are going to be deployed, to which recipients, and in what amounts?
Yeah, and just to start off, this is an incredibly important program for the state. We are one of the states, in fact, we are the state with the lowest number of, I think we are the only state that has 0 number of rural counties in the country. And while the 147 was on the lowest end of awards, just to say that out loud, it was the second highest in terms of per capita rural residents. So, just to give some sort of background to sort of how we're thinking about how that's going. In terms of where that money is being spent, it's in 5 buckets. So number 1, workforce. Number 2, key, I'm sorry, I'm having trouble seeing you behind this camera, key rural serving providers. Number 3, tech-enabled healthcare and community care. 4, prevention, and 5, chronic disease. So some of those buckets are for DOH to manage, some of those buckets are for our department, but we are the primary interlocutor with CMS to oversee the grant and the award.
So those buckets are between health and human services?
Correct, correct.
But human services is responsible for approximately 40 million of it, is that
yes,
correct?
and we're the primary on this.
Primary beyond. Yeah. Okay. Well, that is good, because now I'd like to know if your department plans on receiving receipts and financial disclosures from grant recipients. Would you commit to that level of public transparency?
I think we'll commit to the significant financial disclosures that are required by CMS already. And I will note that because this is a cooperative agreement, it is typically more than is required in typical grants and situations like that. I would need to know the parameters of CMS requirements and how that comports with such a request like that first before answering fully.
I'll ask it anyway. Do you know if receipts and financial disclosures are part of that?
I don't know to the degree that, I know that some is, I don't know the degree to which we can make that publicly available or share that with out.
Understood. We'll follow up. Thank you very
Sure.
much for that. 2 more questions, Commissioner. The most recent
But I do want to add, I do want to say that we are working to make more transparent about this than we have before. I know that, we need to get more stuff out. We need to get more information out. I would just note that even our website needs to get cleared before we can publish those websites. So we are working to get all that out. When I came in the door and said, can we get more out? The team said yes, but we need to, so we're going to work on that. We need to work with our partners to make sure we make more transparency. But I do want to make a general commitment with regard to, without specifically referring to those elements. I absolutely want to get more out in the public. I understand there's been a little bit of a black box here. I want to say that out loud, acknowledge that, and wanted to do more to get more out there.
There has, and I think we discussed this last week in my exchange with the Health Commissioner. I was concerned that our standard operating procedure for these types of grants is the grant is made, we wish you luck, and there's very little follow-up. And I think just basic good government due diligence is to ensure that these dollars are going where they're supposed to, being used in the best and highest way, and there is transparency and accountability throughout the process.
I share that commitment. I would just acknowledge that CMS does need to clear everything we want to put out in public.
Understood. Thank you. There was a lot of talk earlier in the day around paperwork, and that being a reason for individuals not being on Medicaid. The most recent data show New Jersey, the state of New Jersey, terminates Medicaid enrollees for procedural or paperwork reasons at a rate at least 10% above the national average. The state automatically re-enrolls fewer than 20% of qualifying Medicaid recipients, and 27% of applications are not processed within the federally required 45-day deadline. Now, the administration has been critical of federal Medicaid changes, making coverage harder to maintain on account of things like paperwork. But aren't these failures occurring at the state level? This is a failure of state administration, is it not?
I'm not sure those specific data points would welcome those being submitted, but I do want to point out, I said this very clearly right before, which is that we were at 15% for some of these, what we call automated data exchanges. The technical word is ex parte. We're 15%. That is not good. Let me be very direct with you. That is not
terrible.
good. That is not good program integrity. That is not good for the beneficiary. No matter which part of the aisle you sit on, we should all want better in terms of not automatic, but like automated data exchanges where we can verify that person's eligibility from a verified source that we trust, right? 15%, we've gotten better. 15 to 25 to 45 now. We have room to go. I want to get better, but I want to acknowledge the progress we have made in the state and the prior commissioners who sat in my chair to take us from a 15% state to a 40 to 45% state, and we have more room to go. I fully agree with you, there's more room to go there.
Yeah, clearly, because I think a lot of the conversation has been around new paperwork, we're using that term loosely, new paperwork requirements at the federal level being a likely reason for individuals coming off of Medicaid. Well, New Jersey's been struggling with paperwork for years now. It's the state of New Jersey that's failing these individuals on Medicaid as far as I'm concerned. So I share your desire to increase that rate because the state is failing these people.
I do think also some of that data is out of date, and I want to turn it to Director Woods.
Yeah, I agree with that, Commissioner. But to the broader point, I 100% agree we need to do better as a state on our eligibility systems. And just to speak to that in more detail, Commissioner referred earlier to how we have a county-based eligibility system. I am meeting with counties regularly and monitoring their performance. All of our counties get regular scorecards, as Commissioner alluded to. Those are going to be posted on our website in the very near future. We are holding counties accountable as we move forward to January 1st and the federal changes that are coming down the pike there. We are going through a thorough readiness review process with our counties, checking how are they doing on some of those metrics you cited. So how are they doing in terms of hitting federal timeliness? How are they doing in terms of getting their renewals done, processed on time? How are they doing in terms of training their staff, in terms of making sure that they're up to date on the changes to IT systems? All of that we are and will continue to closely monitor and look at all of our options in terms of how we can improve the system. I will also say much of our eligibility work is done through a vendor. We have a very similar process for the vendor. And at the same time, because as has been acknowledged, I think by the chair and by Commissioner, our IT systems are old. They need improvement. We have been partnering with the New Jersey Innovation Authority to modernize those systems. That is a very large share of my day every day is focused on figuring out how to do that. So I just want to be really clear. We are not resting on our laurels saying we had a system that was working perfectly before the federal government came along. But what is true is these additional paperwork requirements for members and for our eligibility workers is going to put much more stress on a system that we are working so hard to modernize and improve. And that's where I get very concerned because those additional requirements people are going to lose coverage, not because they're not eligible, not because they're not working or going to school or volunteering, but because there's a lot of paperwork that needs to be provided and working on what is already a challenging program.
I understand, and I think, the word paperwork is a popular one today. I think it's going to be even more so come, let's say, July 2027, when this really starts to come through 6 months after the start of the year. And I just want New Jerseyans to understand that paperwork is not a new thing for New Jerseyans. In fact, it is something that the state and this department has struggled with for years. So I wish you luck. We will be a partner to you in improving the success rate of, my gosh, it's 2026. Paperwork is holding us back? Apparently so, and that's been the case before this federal administration came along. My last question, if I may. Commissioner, assisted living programs provide services to low-income seniors living in subsidized housing. In Governor Sherrill's proposed budget, I wonder if there might be an error when it comes to ALP rates. Last year, the administration brought ALPs up to $99.10 a day, the reimbursement. In addition, 2 years before that, a law was enacted that brought ALP base rates up to a per diem rate of no less than $89.50. That's the floor. However, Governor Sherrill is proposing a rate of $71.10. That's page D221, paragraph 2. Does that not conflict with the statute, and would that result in assisted living services looking at a $28 per day cut?
Yeah, so Assemblyman, on this matter, and this is going to really frustrate you, and I apologize for this.
It's not paperwork, is it?
No.
Okay.
There is an additional $20 add-on in the governor's budget that is separate from the $71 that you just described. and that would bring the total rate up to $91.10, which is above the $89.50 floor. In terms of how that is vis-a-vis the $99.10, I would say that $99.10 was, as far as our team can understand, a one-year aberrant adjustment to the budget from last year, not consistent with sort of how the rates have been structured prior to that year. And so we returned to the traditional structure of equalizing assisted living centers and assisted living programs, if I have those straight.
So your department's interpretation is that the $99.10 a day was a one-year policy?
We're not sure why, a rationale for that bump up to $99.10, why they would get paid more, for instance, in assisted living programs or centers. For that rate has been sort of parallel for a long time. All of a sudden, 1 year, one went up, and then we're saying, well, we're not sure, there was no rationale for that. So we're just saying we're leveling the playing field and bringing them back aligned. I will say the $71.10 is confusing because there's the $20 add-on is elsewhere in the budget.
Understood. Thank you very much.
Yeah.
Thank you, Commissioner. Thank you, Chair.